In this video, let us see about PAHL scheme. PAHL scheme is a direct DPT, direct benefit transfer for LPG consumer scheme. It aims to reduce the leakage of subsidies and reduce the intermediaries and also eliminate the duplications of the LPG connections by introducing direct cash transfer of subsidies. LPG consumer who join these schemes will get the LPG cylinder at market price and they receive the subsidy directly to their bank account. The scheme required the consumer to mandatorily have a bank account linked with Aadhaar number for availing the LPG subsidy. If they don't possess the Aadhaar number, they will have to link their bank account directly with their LPG ID. Okay, next border hat scheme. What is border hat? India-Bangladesh border hat is a border trade market between India and Bangladesh. Currently, 4 border hats are operational along with the India-Bangladesh border. 2 border huts are located in Meghalaya, Kalaichar and Balat, and 2 are located in Tripura, one at Srinagar and other at Kamala Sagar. There are no border huts operation in the Myanmar and Bhutan borders. In addition to the 4 functional huts, the Government of India and Government of People's Republic of Bangladesh have approved Palbasti and Kamalpur and 4 in Meghalaya, Bolaganj, Nalikata, Sibari and Rainku. Government of India have also executed a MOU with the Government of Republic Union of Myanmar on the establishment of border huts along with their borders. Following commodities are traded in border huts. They are vegetables, food items, fruits, spices, minor forest produces like bamboo, grass, broomsticks, excluding timber. The products of cottage industry like gamcha, lungi, etc. Next scheme we are going to see is Viswa scheme. Viswa is Vanchit Itkai Samo Aur Vargon Ki Arthik Sahatya scheme is Vishwa scheme. Ministry of Social Justice and Empowerment will introduce this Vishwa scheme for self-help groups or SC and OBCs household with an annual income of up to 3 lakhs. The scheme aims to ensure more credit in hands of most deprived households for productive and economic activities. Under the scheme, interest subvention will be provided to the self-help groups with 100% OBC members and OBC individuals who have taken loan for various income-generating activities for those lending institutions who have signed MOU with NBFC DC. Under the scheme, SC, OBC self-help group and individuals will be able to avail the interest subvention of 5% interest per annum for bank loans up to 4 lakh per self-help group and 2 lakh per individual. The scheme would be help in immediate liquidity as it would direct beneficiary transfer mode of crediting the operational accounts of the individual and self-help group. One next scheme we are going to see is One Nation, One Ration card. What is it all about? It's about the families who have food security card can buy the subsidized rice and wheat from any ration shop in these states, but their ration card should be linked with the Aadhaar number to avail this service. One Nation, One Ration card will ensure the beneficiary, especially migrants, can access the PDS across the nations from any PDS shop of their own choice. Benefits. No poor is deprived of getting the subsidized food grains under the food security scheme when they shift from one place to another. It also aims to remove the chance of anyone holding more than one ration card to avail the benefits of different states. Significance. This will provide freedom to beneficiaries as they will not tied to any one PDS shop and reduce their dependence on the shop owners and curtail instances of corruption. Standard format of One Nation, One Ration card. A standard format for ration card being prepared after taking into account the format by using different state. For national probability, the state government have been asked to issue the ration card in bilingual format, wherein besides the local language and other language would be in Hindi and English. The states have also told to have 10-digit standard ration card number, wherein first 2 digits will be state code and next 2 digit have been next 2 digit will be running ration card numbers, and besides a set of 2 another digit will be appended with the ration card number to create a unique member ID for each members of the household in the ration card. Next scheme we are going to see is Pradhan Mantri Garib Kalyan package. Insurance scheme for health workers fighting COVID-19 in the government hospitals and healthcare centers. Safai Karamcharis, ward boy, nurses, ASHA workers, paramedics, technicians, doctors, specialists, and the other healthcare workers would be covered by the special insurance scheme. Any health professional who, while treating COVID patients, meet any accident, they would be compensated with the amount of rupees 10 lakh under the scheme. All government health centers and wellness centers and hospitals of center as well as state would be covered under the scheme. Approximately 22 lakh health workers would be provided insurance cover to fight the pandemic. Next is Pradhan Mantri Garib Kalyan Anna Yojana. Government of India would now allow anybody, especially any poor family, to suffer any account of non-availability of food grain due to disruption for next 3 months. 80 crore individual, that is roughly two-thirds of the India's population, would be covered under the scheme. Each one of them would be provided double of their current entitlement over the next 3 months. This additionality would be free of cost. Pulses. To ensure adequate availability of protein to all above mentioned individuals, 1 kg per family would be provided pulses according to the regional preferences for the next 3 months. This pulses would be provided free of cost for Government of India. Pradhan Mantri Garib Kalyan Yojana. Benefits to farmers. First installment of rupees 2000 in 2020-2021 will be front loaded and paid in April 2020 itself under PM Kishan Yojana. It would cover 8.7 crore farmers. Cash transfer under Pradhan Mantri Garib Kalyan Yojana. Help to poor. A total of 20.40 crore PM Jandan Yojana women account holders would be able to would be given ex gratia of rupees 500 per month for next 3 months. Gas cylinders under Pradhan Mantri Garib Kalyan Yojana, gas cylinders free of cost would be provided for 8 crore poor families for the next 3 months. Help to low wage earners in the organized sector. Wage earners below rupees 15,000 per month in businesses having less than 100 workers are at the risk of losing their employment. Under this package, government proposes to pay 24% of their monthly wages into their PF account for the next 3 months. This would prevent disruption in the employment. Support for senior citizens above 60 years, widows and Divyangs. There are around 3 crore aged widows and people in the Divyang category who are vulnerable to the economic disruption caused by COVID-19. Government will give them rupees 1,000 to tide over the difficulties during the next 3 months. M&Rega, under Pradhan Mantri Garib Kalyan Yojana, M&Rega wages would be increased to rupees 20 with the effect from April 1, 2020. Wage increased under M&Rega will provide an additional rupees 2,000 benefit annually to the worker. This will benefit approximately 13.62 crore families. Self-help groups. Women organized through 63 lakh self-help group support 6.85 crore household. Limit collateral free loan lending would be increased from 10 to 20 lakhs. Other components of Pradhan Mantri Garib Kalyan package are organized sector, that is employee provident fund regulations will be amended to include the pandemic as the reason to allow the non-refundable advances of 75% of the amount for the or 3 months of wages, whichever is lower for their account. Families of 4 crore workers registered under employee provident fund can take benefit of this window. Building and other construction workers welfare fund. Welfare fund for building and other construction workers has been created under the central government act. There are around 3.5 crore registered workers in the fund. State government will give a direction to utilize this fund to provide assistance and support to these workers to protect against the economic disruptions. District Mineral Fund. The state government will ask to utilize these funds available under District Mineral Fund for supplementing and augmenting these facilities for medical testing, screening and other requirements in connection with preventing the spread of COVID-19 pandemic as well as treating the patients affected with pandemic. That's all. Thank you.